This is Inside Cape Cod. I'm Sarah Colvin, and joining me today in studio, I welcome Lisa Guyon, the Director of Community Benefits for Cape Cod Healthcare. Lisa, welcome, and thank you so much for joining me.
Thank you for having me.
So, Lisa, before we get started, we're talking, of course, about the Community Health Needs Assessment, but talk to me a little bit about your role at Cape Cod Healthcare and in community benefits. What does that job entail?
Sure. So community benefits is a very interesting job within healthcare systems. Essentially, my work is about connecting what we do within the hospitals to the work that happens out in the community. And whether it's programs that we run that benefit residents in the community, or if there's community programs that we can support through a variety of different ways. So my focus is really about building, managing, and identifying programs that really improve the health of residents of Barnstable County.
Indeed, because I think, health, while it is an individual thing, also has really a great deal to do with the community in which you live and what's available and accessible to you.
Absolutely.
And the health of the people around. So this is a process that's just underway, and you did one for 2014 to 2016. So talk to me a little bit about the health needs assessment and why it's important to do one of these.
Sure. Hospitals do community health needs assessments all the time. It's part of how we plan for what the services are that are needed within the community, and identifying different populations that we should be reaching out to. It's actually now required through the Affordable Care Act, and so every nonprofit hospital in America has to produce a needs assessment every 3 years. And that's, I think, a very good thing, not just because it's helping us do it in a sort of real-time manner, but it's helping us identify how we look at things every 3 years as a benchmark. So what's changing, what's different, what's trending, what's staying the same, and why. And so this community health needs assessment process is very similar to the process that we used in 2014, and that's purposeful. We want to sort of keep the processes similar. But I would say we're definitely enhancing the data collection piece of what we've done in the past. And essentially the purpose of the needs assessment is to look across the community, look at the data that's available, the health data that's available, identify what the most significant health needs are in the community. There are lots of needs, but as a health system, we have to really identify what are the top most sort of significant. And we look at the severity, the scope, the frequency of issues, and kind of prioritize those issues that really rise to the top. We then look at those priorities and develop a plan around how we're going to address those, using the resources that the hospitals have and that's available in the community as well.
Great, and I think it would be easy to say, let's just take the data that comes into the hospital, look at the patients, ER visits, that sort of thing. But the health of the community is much more than just the people who are using the healthcare system.
That's right. I mean, I like to say that people don't come to hospitals because they're healthy.
Right.
So people's health is generally managed in their home, in their community, and like you said, there are a lot of factors that determine the level of health and access to services that people have. So this is really, for me, sort of a roadmap for us, and it helps us think about what we're doing as a both hospitals, but also as a community health system, but also what's happening in the community and what's not happening in the community. And so it's really, really helpful. We have, and it's not just data collection. We utilize all sorts of statistics and information that's available, from cancer rates to mortality rates to disease rates, how many people are insured, what does our demographics look like. We're able to look at mortality and births and all sorts of really interesting sort of statistics. But I would say, and that's really the quantifiable information that really helps sort of set a stage, but where we really get down to understanding the real needs of people and what's available and what's often the barriers that people even have to accessing the things that are available in the community. That's where we go through a whole community input process and get the general public involved, get nonprofit leaders involved, public health experts involved as well.
Great. So let's talk about this document that I keep looking at. This is the one from 2014 to 2016,
Correct.
And as our viewers can see, it's a pretty comprehensive report that lays out all the information that you found. So let's talk a little bit about what's in this and what the last health needs assessment told us about Cape Cod.
Great. And again, like I said, it's sort of a platform to build off of. And so it told us a few specific things. The first is the demographics of the Cape are different and unique than the rest of Massachusetts. We are an older county that's generally older. We're a decade, our median age income is median age is a decade older than the rest of the state.
Wow.
Yeah, so we're 49.9 years old is our median age on the Cape, and it's 39 years anywhere else in the state. So we have a growing rate of people who are 85 and older, and a big group behind them, which are the baby boomers. And so we are a community that's old and getting older, and that presents a unique set of challenges for a healthcare system. Typically, the older your population is, the more reliant they are on the healthcare system. And so that really helps us think about what are the kinds of services that need to be available. So I would just say generally from a demographics perspective, that's something that creates a framework. We really started to look at what were the rates and the diseases that were really popping up. We were able to identify a number of things, but there were really 4 core priorities that rose to the top. The first was chronic disease, and again, this isn't something that's surprising given our demographics. So within those chronic, and I would say actually chronic and infectious diseases, within those chronic and infectious diseases, cancer, diabetes, heart disease, Lyme disease,
Big thing here
big thing on the Cape, hepatitis C, and we have a high prevalence of HIV in our community. So not a high incidence. We're not saying new cases, but there are a fair amount of people in our community who are living with HIV. And so again, what kind of response does the healthcare system have to have? So chronic and infectious disease was one, and the second was access to care. We actually have great care on the Cape, and we have we have a decent amount of care, although, we could always have more primary care, we could always have more mental health providers. But we also found that there were access issues. So what were the barriers that people were encountering? And we saw a few things. The first was language. So a percentage of our population that just language is a general barrier to getting even through the front door of care. Transportation, as we all know. Even with the new health insurance products, that's created a little bit of a challenge because there's high deductible plans now. And so even some of the new products, people who are newly insured, they can't quite afford it, or the prescription. So there's a cost barrier as well. And generally, I think, looking at the layout of our community. So the Mid-Cape is really concentrated with health services, where the further you go out on both ends, the Upper Cape and the Lower and Outer Cape, it's a little bit harder to access services.
Exactly. I mean, I'm thinking about myself living in Hyannis. I'm like, oh, it's easy. I can walk to the doctor or the hospital or whatever. But growing up in Chatham was not the same way. It's a far away. It's a drive.
Yeah, I can remember I grew up in the Lower Cape too, and it was the hospital was a half hour away.
Right.
Was the closest emergency. The other 2 issues that really rose to the top through the needs assessment in 2014 were, and I don't think this is a surprise to anyone, but mental health and substance abuse. And what we saw there were we had. And a lot of this it's both the rates and data that we were looking at, but also the feedback from the community. We're seeing a high volume of mental health issues presenting in the emergency departments. And when you really dig in and unfold that issue, a lot of what we were able to identify is that there just really wasn't adequate services available in the community for people. And so where they weren't able to get an appointment for 8 to 10 weeks, they were using the emergency room more in sort of a crisis mode. And so so mental health and the shortage of providers and community-based support and substance abuse, which we're seeing a whole scope of issues related to substance abuse, but for the data was telling us essentially that we had double the rate of substance abuse treatment admissions than the rest of the state. So and it's hard to. Is that a good thing or is it a bad thing?
Right, it's almost a double-edged sword. It's like, yes, it's great that there are more people seeking help, but there's more people seeking help. That means there's more people with a problem.
Right, and it's very difficult to find accurate data about usage rates or how many people are using, although the county, Barnstable County Human Services has done a great report over the last year, and they estimate about 3% of the population, we talk about the opiate issue, it's about 3% of our population is struggling with that issue. But we also have an endemic problem here, which is alcoholism. And so, the rates are higher on the Cape for people who are getting treatment for alcohol and growing for those who are getting treatment for opiate addiction.
Absolutely, and really I think that that conversation is probably going to play a big part as you head into the next phase of the community health assessment. Obviously, I think that as longtime Cape Codders, we know that the issue has been around for a long time, but it seems the conversation is getting a little louder in recent days, and certainly with the power of the opiates and the overdoses that we've seen, certainly trying to find a way to figure that out. And the mental health aspect too, thinking, if it takes 8 to 10 weeks to get an appointment, when you're at the point where you say, I need some help, you need it right away. You can't wait those 10 weeks.
That's right. And so a lot of the findings of that report that was released in 2014 or late 2013 have been the stage for which we've built programs, both within the hospitals and outside. And mental health and substance abuse. I mean, we've created some new approaches to care within the hospitals related to mental health. We now have within the emergency room, psychiatric nurse practitioners who are part of the emergency care teams. You don't see that in most emergency rooms. We've also expanded the outpatient services that we offer through the Centers for Behavioral Health that's part of Cape Cod Healthcare. We've also been part of a larger community effort to develop a coalition of behavioral health providers. And the idea there was there are, lots of things that are falling through the cracks. If we could develop a coalition of people who are providing these kinds of services, could we better coordinate care? And that has taken shape, and we have 40 plus organizations that are part of that now. Substance abuse, in 2014, there wasn't a regional response to this issue. Right now, we have a regional substance abuse council, and that, we have 40 members representing almost every town on Cape Cod, every healthcare, schools. I mean, and I'm not saying that the report was the genesis of that, but to see how many things, even related to chronic and infectious disease, that have been developed just in 3 years, going into this next assessment project allows us to say, wow, look what has been built, but also look what gaps are still available, and how do we strengthen what we were already doing, and how do we develop new approaches to things that aren't being addressed.
Absolutely. Can I ask about Lyme disease? I mean, I know we mentioned that was one of the big issues, and that certainly is something that, I know personally so many people that have it, and I think what I've heard over and over is the challenge of getting it properly diagnosed and then finding the right treatment. And is that something that you're seeing being paid more attention to within the healthcare community?
Yeah, I think the Lyme is a very controversial issue within the healthcare community and outside and within the community of people who are advocating around the issue. I think we're going to see some legislation coming down that's going to really prompt insurers to treat and be willing to sort of treat Lyme differently, and the conversation around Lyme as a chronic disease versus just being an infectious disease. That conversation is certainly taking shape. We are dealing with that within our own infectious disease work within the hospitals. Testing is getting better. I think advocacy plays an important part of taking a health issue that's in the shadows and really bringing it forward. And I think we have a great grassroots advocacy community on the Cape that are really advocating for more dialogue about Lyme's. For us, what we realize, and as a health system, we look at these health issues and we say there's really 3 approaches. There's prevention, there's intervention, where something is happening or we think something is happening, how can we sort of intervene? And then there's management. So there's, preventing Lyme's, there's, intervening when something's going on and maybe getting the right diagnosis, and then when someone has Lyme's, treating that appropriately. I would say over the last couple of years, we've put a lot of effort behind the prevention side. We've been working with Cape Cod Cooperative Extension and Larry Dapsis. Everyone knows Larry.
Great guy.
He's the tick guy.
He is the tick man.
Cape Cod, and he's fantastic. We started by funding a project that provided signs on trails across Cape Cod, just to identify that ticks are available. Here's what they look like. Last year, we funded a project with the Cooperative Extension that provided a mailer to every person on every single household on Cape Cod. It was an education mailer about tick-borne illness, showed all sorts of ticks in real size, talked about resources if you were bitten by a tick, the things that you could do. This year, we are actually funding a tick testing and surveillance program. So you can sort of see how we're kind of progressing in our work with just this one issue, where we will subsidize testing for Cape residents who want to send, if they've been bitten and they get the tick,
Right.
they can send it up to UMass, and we will subsidize half the cost of those tests, and you will get an epidemiology report literally within 36 hours that will tell you did this tick have any infectious disease? If so, what is it? And that's something that you can share with your healthcare provider. And it does two things: a little more accuracy to the diagnosis, and for a lot of people, hopefully preventing people from taking antibiotics they don't need.
Exactly,
So,
which
it
can
just gives an
cause health
example.
problems in and of itself.
Right.
So yeah, and I know that was a very effective campaign, and then Larry's been out there, the one bite can change your life,
Yes.
really making sure. But and the tick testing, I think that's fascinating. So don't flush it, don't throw it away, put it in an envelope and mail it up to UMass,
Yeah.
and they'll tell you all about that tick.
I actually did that. My mom was bit last year. We kept the tick, we sent it, and within 24 hours, we had an email report back that the tick had no infectious disease whatsoever. And what a relief that was. My mom she was on her way to the doctor to get onto antibiotics, and to be able to have that.
Exactly,
Yeah.
is a nice
Definitely.
peace of mind indeed. So let's talk about the current process. So I know that some community forums have already been held. Where are we in terms of the information gathering, and when do you expect to turn out the next report?
Great. So we are really at the tail end now of the data collection, which is the statistical collection, information and data statistic collection. We have held 3 community forums. That was for the general public. We had over 60 people.
That's great.
Yeah, participate and attend these sessions. We had one in Orleans, one in Yarmouth, and one in Falmouth. We are holding 2 more forums in January for health and human service organizations, so people who lead those organizations, or health-based organizations, lead those organizations, to be able to come in and give us their input as organizations that are really dealing with very specific issues. So we'll hold 2 more of those. As of this morning, we had 60 more people signed up.
That's fantastic.
For those forums. We're doing key informant interviews, and so we've interviewed about 25 health and human service and public health experts on the Cape, from from police sergeant to physicians in the community. A really interesting list of people. We're going to continue to do a little bit more of that, and then by February we will sort of have our sort of comprehensive findings through this process. And then we go through the next processes, which is we look at all the issues, what really rose to the top, what is the most significant of all the issues that were brought forward, and identify the most significant and then prioritize them. Then we go through our strategic planning processes. Now, what are we going to do? We don't have limited resources. No one organization can work on a particular issue. So part of that strategic planning is not just what are we going to do, but who do we partner to get the work done, and who do we support who's already doing the work. And so that's a very long process. I'll essentially be writing this report for the next 4 months. We will release, and then it gets vetted, within Cape Cod Healthcare. We sort of make sure all the I's are dotted and the T's are crossed, and build some support with the clinical leadership and the administrative leadership. And then we release it to the public at the very latest will be October 1st of 2016.
Great, very.
And then I go on a road show, and I do a lot of this. I talk about what did we find, what are we going to do about it, how do we do that?
Absolutely, and formulate those plans and making sure to take the action that's necessary. So, as you said, more forums. Obviously, we're still in the data collection, the raw data stage, but are there any themes that you're seeing emerge through the community forums, anything that people got up and said that really resonated with you and said, this is something that we're going to see as an issue?
I wouldn't say we're going to see anything drastically different than maybe what we saw a few years ago. I mean, the issues that we were identified were so significant that they don't typically change all that much within a few years. So what I would say is, even a few years ago, where there was this sort of equal sort of voice between chronic disease and prevention and wellness and health, general health, and mental health and substance abuse, I would say the voices around mental health and substance abuse as issues are just dominant. I mean,
Right.
and I think that that's a very positive thing. I think we are, as a community, are talking about, and stigma is an issue that we talk a lot about related to substance abuse. I think that the governor, I think locally, the work that we've been doing around really trying to reduce stigma related to substance abuse and talking about it as a chronic disease is allowing the community to have more of a conversation about this. So I would say those two issues have really rose to the top. I would also say I think we as a community are really wrapping our brains around the wave of aging that's happening here,
Right.
and really trying to be ready for that. So we're hearing more about Alzheimer's, Parkinson's, age-related dementias are really part of the conversation in a little bit more of a dominant way.
And I think we're gonna see a lot of diversity as well as we see the baby boomers get older. I mean, that's a large group of people, and I think many baby boomers are very health conscious, whether they have been exercising, going to the gym, making sure they eat, take the vitamins, whatever. But there again, that's just a small part of them, and I think it will be interesting to see what develops or what the concerns are as those baby boomers start to get older.
Yeah, I think, so we've got that issue that's coming into shape. We've got healthcare reform, which is coming into shape. It's a very interesting time to be observing community health because all of these things are sort of, we're in an age of change, and it's going to be really interesting to see how it all comes together in the next 10 or 20 years.
Absolutely. So if our viewers or listeners have questions, they want to know more, or they want to share input with you, what's the best way for them to kind of find out more about this process?
Sure. So what I would say is if you're interested in the existing community health needs assessment, you can find that on Cape Cod Healthcare's website. If you go to our website, learn more about us is the first tab, and then caring about our community, you will be able to download the report, and that gives you a nice platform to think about what's already been sort of identified through the last process. We, like I said, will be continuing to do this data collection through January, till the end of January. People can call me directly. Is it okay if I give my?
Of course.
508-862-7896. I'm happy to hear input. Also, you can send input via email, which is communitybenefits@capecodhealth.org. The two forums will be held, one on January 6th at Falmouth Hospital from 9 to 10:30 in the morning, and then on January 11th at Cape Cod Hospital from 3 to 4:30. I would appreciate if you would like to attend, to please let me know in advance as we're planning. But so there's lots of ways to still get involved. I would say, a great way to get involved if there's an issue you really care about, to find an organization in the community who's really focused on that issue or doing work around that issue, to get involved. They often know how to advocate in a bigger, louder way for issues that are important to that group. So I would advise people, if you're looking to really get engaged and have a louder voice, you can do it certainly through this process, but there's a lot of great organizations that could use that voice as well.
Excellent. Well, Lisa, I thank you so much for coming to join me today on Inside Cape Cod. I appreciate it.
Thank you so much.
Thank you so much. Lisa Guyon, of course, is the Director of Community Benefits for Cape Cod Healthcare. I'm Sarah Colvin.